Hey guys, for budding dentist or for experience also, treatment of dry socket or management of dry socket is difficult or a challenging job. So here I will discuss some of my experiences of treating dry sockets. So first of all, we have to try to prevent dry socket by as much as less traumatic extraction. After extraction, proper guidance that what to do, what not to do to the patient, and also medications. Sometime when you think that there may be a chance of infection or previously infected tooth, so you should give proper antibiotic for preventing dry socket and all. So these three things: less traumatic extraction, then proper advice after extraction, and proper medication. These three things first of all you should do. But you never know which tooth may come out with dry socket. Classical feature that after 2 days of extraction, patient will come with huge pain, with excruciating pain and foul smelling, sometime bare bone. You can easily see the bare bone, and if you touch with the probe, that patient will say that it is very much painful. So these are typical features of dry sockets. Now, treatment of dry socket is in three parts. First of all, giving analgesics. Second, obtendant dressing inside the socket, and third, giving antibiotics. These three modalities we can try, or we can try the modalities one or combination of another one as per the complaint or as per the scenario of the patients. So most of the cases, normal painkiller and obtendant dressing like zinc oxide eugenol, Alveogyl or other paste available for dry socket, they are sufficient for treating dry socket. But my concern is how to give that dressing, and when to give the dressing, and which dressing you will prefer. So if Alveogyl is available, that is the best as per my knowledge, because I used other pastes also, but Alveogyl is very good. Patient response from patients is very good, and you should use that Alveogyl after irrigation. Do not curate that socket, because if you curate, patient will feel excruciating pain and it will not help much. So curettage is not a recommendation or contraindication in case of dry socket, unless until other factors are there. Curettage is not the treatment. Irrigation with normal saline or irrigation with antiseptic solutions like povidone iodine, and after that giving that dressing. If you are using zinc oxide eugenol paste, then you have to mix the zinc oxide and eugenol, and you have to impregnate it with the cotton piece, and you have to place it inside the socket, and you have to call the patient for 3rd day, 5th day, 7th day and 10th day for the change of dressing or follow up. If you think that after 5th day or after 2nd dressing, patient says that my pain is reduced, I have no problem with that, then you may discontinue the dressing as per the patient's complaint. You have to give the treatment. In case of Alveogyl, you have to just place very little amount of Alveogyl. The composition of Alveogyl is eugenol, iodine, iodoform, and butamin, and different kind of mineral oils also. So the composition is also better than the zinc oxide eugenol. So Alveogyl use very small amount of Alveogyl in the wall of that dry socket, and you have to recall that patient just like I have mentioned earlier. After application, 3rd day, then 5th day, 7th day and 10th day. There is a thing. Like today I applied, then you have to give recall the patient after day after tomorrow. That is 3rd day. First day, today is 1st day, 2nd, 3rd day. So this kind of treatment is very much important in case of dry socket. You have to have knowledge to manage dry socket, because it's a very painful condition. And another thing is very important, that you should know about the unhealed socket and dry socket. In case of unhealed socket, the pain remain after 15 days, 20 days also. In that case, you have to think differently, that infection may be there may be osteomyelitis kind of thing may happening, something like that. That is a different topic. I'm just talking about the dry socket. So you have to diagnose the dry socket first, then you have to irrigate and you have to apply the obtaining that agent like chicoxydigenol paste or alveogyl, and you may prescribe antibiotic if there is a post discharge or pain is excruciating or headache is there, fever is there, like that. So these were the modalities of treatment of dry socket. This may help for budding dentists. I know that it will help surely. Thank you very much for patience listening.